Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
One of the biggest changes in first aid and pre-hospital care over the past decade has been the cervical collar. For years, if somebody's had a suspected neck or spinal injury, the answer seemed simple. Put on a rigid cervical collar, put them on a spine board, and don't let them move. But today, things have changed. First aid treatments and many ambulance services across Australia have moved away from the routine use of rigid or semi-rigid cervical collars. So, why? The purpose of a cervical collar is to limit the movement of the neck when a cervical spine injury is suspected. Traditionally, hard collars were used to immobilise the neck following things like motor vehicle accidents, falls, sporting injuries, and other trauma. However, research has shown that these collars may not provide the benefits we once thought. Currently, the Australian Resuscitation Council ANTS core guidelines do not recommend the routine use of semi-rigid collars by first aid providers. Instead, initial management focuses on manual support of the head in a neutral position while limiting unnecessary movement. Soft collars are recommended as a reminder that neck injury is suspected, but they do not provide true immobilisation and are considered inferior to manual support. So why have hard collars fallen out of favour? Well, research has identified several potential problems, and these include movement of the neck during sizing and application, increased pain and discomfort, pressure injuries, difficulty swallowing, especially with an altered conscious state, restricted mouth opening, airway problems if the patient vomits, potential increased intracranial pressure in patients with head injuries, and delays in transport and patient care. And you know what? Perhaps the most important thing is that those collars may not significantly reduce spinal movement as much as people previously believed. The Australian Resus Council ANTS core guidelines now recommends that rescuers support the head in natural, neutral position and avoid unnecessary movement. Of course, there may be still some specialist situations where immobilisation devices are used, such as certain rescue environments, but for most first aiders and first responders, the priority remains simple. Manage the airway, support the head, minimise movement, and move the patient only if necessary for safety. Because sometimes in healthcare, doing less is actually doing better, and the science tells us that in this situation. And one of the biggest changes in spinal care has been learning that the collar isn't always the best answer.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.